You know that feeling? You're in the exam room, trying to explain what's wrong, but your doctor's focus is just glued to their computer screen. We've all been there. But what if it didn't have to be that way? Today, we're going to talk about how AI is stepping into the clinic, not to replace your doctor, but to take over one of the most draining parts of their job, taking notes. Just look at that number, 40%. For some doctors, that's nearly half their day spent on administrative tasks and paperwork, not with patients. That's not just some small inconvenience, it's a huge roadblock in our healthcare system. And frankly, it's a major reason why so many of our best clinicians are feeling completely burned out.
But imagine this, what if an AI could just listen in on the conversation between you and your doctor and handle all of that documentation automatically? That's the really powerful idea we're diving into today.
So first up, let's really unpack this problem, the documentation overload. Because, this isn't just about a mountain of paperwork, it's about the very real, very human cost of burnout in medicine.
The real headache here isn't just about how fast a doctor can type. It's the tricky process of translating a normal, flowing human conversation into the super rigid, structured data that a patient's electronic medical record, or EMR, demands. That translation step is where so many hours just vanish.
So how in the world can technology even begin to fix this? Well, it all starts with a fascinating corner of AI that's all about understanding language.
It's called natural language processing, or NLP for short. And simply put, NLP is the magic that lets computers actually get a handle on human language. You've seen it in action with things like Siri and Alexa, but here it's being fine-tuned for the incredibly complex world of medical conversations.
Okay, so how does this work in a real clinic? It's basically a three-step dance. Step 1, the doctor just talks, either dictating a note or just having a normal conversation with a patient. Step 2, the NLP system listens in, transcribes everything, and analyzes the text. And then step 3, this is where it gets really brilliant, the AI plucks out all the key medical info, symptoms, medications, diagnoses, and organizes it perfectly for the patient's record.
All right, enough theory, right? Let's look at how this stuff actually transforms those messy, rambling notes into clean, useful data that can be used in the clinic.
And what's really amazing is that the applications go way beyond just taking notes. This technology can whip up a summary of a patient's entire medical history in seconds. It can flag critical data points. It can even help with those ridiculously complicated medical billing codes. It's an incredibly versatile toolkit.
Okay, let's do a little side-by-side comparison. Here's a pretty typical note that a doctor might dictate. It's conversational, a little jumbled. All the important info is in there, but it's completely unstructured. It's just a block of text.
And boom, look at this. This is the after. The NLP system takes that exact same rambling note and instantly pulls out the key data points: symptom, onset, medication, condition, and plan. It's clean, it's structured, and it's ready for the medical record in a tiny fraction of the time.
Now, this all sounds pretty incredible, almost too good to be true. But there's a huge catch. AI absolutely cannot and should not do this work alone. The human in the loop is not just important, it's essential.
It really boils down to this. AI is a powerhouse when it comes to speed and processing massive amounts of data with perfect consistency. But we humans bring something to the table that AI just can't replicate: critical judgment, an understanding of context, and the ability to read between the lines.
And the challenges here are very real. These systems can get tripped up by different accents or if multiple languages are being spoken. A simple, ambiguous phrase could be dangerously misinterpreted by the machine. And maybe most important of all, protecting patient data privacy and staying compliant with HIPAA is totally non-negotiable.
This quote really just says it all. The AI is an incredibly powerful assistant, a tool, but the final responsibility, the final sign-off on any note, has to belong to the human clinician. They're the only ones who can ensure the note isn't just accurate, but that it makes complete clinical sense.
So, where is all of this heading? Well, what we're really looking at is a fundamental reshaping of the entire clinical workflow, one that could free up doctors to finally focus on what they do best, taking care of patients.
Okay, so let's bring it all home. What are the big takeaways? Natural language processing is the key that unlocks AI's ability to understand medical language. It slashes that crushing burden of manual data entry, it makes our electronic medical records way more useful, and ultimately, it saves precious time and helps fight clinician burnout.
There's no doubt this technology is a total game changer for medical documentation, but it leaves us with a much bigger question for the future. As this AI gets better and smarter, where do we draw the line?
How much of that sacred space in the exam room are we, as a society, truly willing to automate?